Let's go ahead and call our meeting to order since it's 4 o'clock. Good afternoon. Thank you for joining us. So I'll call to order our meeting for Thursday, November 12, 2020 for the Emergency Medical Care Advisory Board. We're going to forego the flag salute since we're not in the same location. Jeff, Mr. Ferris, could you call roll for us?
Yes, sir. Thank you, Mr. Chairman. Sheriff Youngblood. Dr. Lyon.
Here.
Chief Shoemaker.
Here.
Okay. Bruce Peters.
Here.
John Surface.
Yeah, I'm here, Jeff.
Okay. Chris Miller.
Here.
Kathy Prout. Supervisor Maggard is present. Dr. Kansen.
Here.
And Leslie Wilmer.
Here.
We have a quorum, Mr. Chairman.
Good. Thank you very much. Well, welcome everybody. We have some things on consent, as you can see here. Does anybody not have an agenda available to them? Everybody's okay with that? Okay. So on our agenda, you can see what items with the CA are routine in nature, as designated by staff. We can take anything off consent we don't want to have on consent. But items 4 is our consent calendar. Then item 5 are minutes. Under item number 10, all the items A through E are on consent. I think that's all of them. Do any members of the MCAB board want to pull any of those items from consent to address it separately? Okay, I don't hear anyone saying they do. Mr. Ferris, are there any members of the public that are in attendance that we should see if they would like to make comment about any items that are on consent?
There are members from the public that are currently present. We can ask if anybody has any questions.
Okay, so if you're a member of the public and you would like to ask a question about an item on consent, now's the time to do that before we vote on them all at once. So if that's the case, can you identify yourself and let us know which item you'd like to ask a question about? I don't hear that anybody is trying to do that, so I'll conclude that there is no public comment about consent. So do we have a motion then? And could you guys give me your, if you're going to make a motion, would you say this is so-and-so, this is Bruce Peters, for example, I'll make the motion and then somebody else, Kathy Prout, could say this is, I'm just throwing out names, but please identify yourself so I can tell who's who and the record can tell. Is there a motion to approve consent?
Chris Miller. I'm sorry, go ahead.
Bruce Peters, I'll make the motion.
Thank you, Bruce.
It's Chris Miller and I'll second.
Thank you, Chris. Okay, we have a motion and a second. I think the way to do it would be for us to do a roll call, Jeff, so it's clear who's who. So could you do a roll call vote for us?
Yes, sir. Thank you, Mr. Chairman. Dr. Lyon.
Yes.
Chief Shoemaker.
Yes.
Bruce Peters, you motioned, so I assume you're a yes.
Yes.
John Surface.
Yes.
And Chris Miller seconded. I assume you're a yes.
Yes.
Supervisor Maggard.
Yes.
Dr. Kansen.
Yes.
And Leslie Wilmer.
Yes.
That is approved. All ayes.
Very good. Thank you. Next is item number 6, which is a subcommittee report. I asked at the last meeting for Mr. Ferris to work with us to see if we could help with the acronym for this is APOT, which is Ambulance Patient Offload Time, and the ongoing issue of ambulances being held at hospital sites before they can offload the patient and leave. I have a couple little things to read about this, and then I'm going to ask Jeff to explain a little bit about a suggestion that I have that we create a subcommittee looking for members from hospitals and ambulance companies to be represented to try to work towards a solution if we can do that going down the road. So extended offload times can have a direct effect on our ambulance providers' ability to meet their contractual obligations with the county and their ability to provide life-saving responses in our community. We realize there are many factors at play, and it's not going to be a simple thing to find a solution, but we think that it's important that we try to see if we can. So with that in mind, we're looking for volunteers to form this ambulance patient offload time committee, or task force rather, APOT task force, to go forward to see if we can work on the issue some. So Jeff, Mr. Ferris, could you explain a little bit about how you're envisioning that we might come up with this task force?
Yes, thank you, Mr. Chairman. I'm hoping that we can do this on a volunteer basis, and what I'm going to do is first of next week send out invitations or letters to all of the CEOs of all the hospitals requesting that, excuse me, that they volunteer or have somebody volunteer from their facility to sit on the task force, and also from the ambulance providers in the county, so that we can at least sit down and begin to dialogue about the situation and try and come up with some way to down the line help fix the problem. It is, as Chairman Maggard said, it is a complex issue. We realize that. We know that there's not going to be a simple fix, but at least to start the discussion and start looking into solving the problem is the best place for us. And that we think it's time that we take that first step and start at least talking about the problem. So I'm going to be sending out letters to the CEOs next week asking for volunteers, and to the ambulance providers as well.
So this was a request I made at a previous meeting, but it's on here just so we can all talk about what you understand what the concept is. Are you guys okay with us proceeding? Are my colleagues on the MCAB board okay with us proceeding with trying to come up with this task force? And do you guys have any thoughts about it?
I'll speak for the hospitals. I'm okay, as Bruce, with setting up the task force. I'd only ask that we forget about July and August.
Okay.
It was a nightmare.
Yeah, it was a nightmare. You know, and what worries me is, are we moving towards another nightmare? You know, we
probably are.
Yeah, we don't know that yet. Yeah. Okay. Anybody else have any thoughts, any concerns for us to proceed in this direction? If you have a concern, we don't want to step over anybody as we try to figure out how to handle this. Anybody have any other concerns?
Chairman Maggard, John Surface here. We certainly are willing to participate, and we encourage any dialogue on the subject. We've been talking about it for about 15 years now, so we're absolutely okay with participating.
Okay. Thank you. Any other members have comments then? So then if it's okay with everybody, we'll direct Jeff Ferris to put together this ad hoc committee, and then as we proceed, Jeff, you can give us some updates as to how, what kind of progress we're making periodically. Can you report back to us how it's going?
Yes, sir, Mr. Chairman, will do.
Okay, thank you very much. Okay, next is item number 7, which is public comment. This portion of the meeting is reserved for persons desiring to address the board on any matter that is not otherwise on this agenda, over which the board has jurisdiction. So we have some other matters we're going to discuss in a few moments, but are there any members of the public in attendance on the call today that want to talk to us about any matter that is not otherwise on our agenda today? Just make one more time to make sure. Are there any other members of the public that want to make comment about an item not on our agenda? Okay, I don't hear anybody, so we'll proceed with that. Thank you. There are no requests from the public to make a specific presentation today. Is that right, Mr. Ferris?
That is correct, sir.
That would be item number 8. Okay. So next would be unfinished business. And Mr. Ferris, why don't you set this up for us, and then I think we're going to hear from Dr. Lyon. Is that correct?
That is correct. Thank you, Mr. Chairman. At this point, Dr. Lyon is going to present his final decision following the hearing that occurred on 2 months ago, actually, or close to it, on the auto pulse and the request from Hall Ambulance. Dr. Lyon.
Good afternoon, everybody. Thank you for taking the time to be here. I want to start out by thanking all the members of the MCAB board. I appreciate your professionalism, engagement, and insight into this matter. I also want to thank Hall Ambulance for their dedication to Kern County and their willingness to bring forward new ideas to improve our system of care. Since the last meeting, I have had the chance to reflect upon the proceedings. I reviewed our data and findings several times. I have consulted with several world-renowned EMS physicians who are experts in cardiac arrest resuscitation and have published landmark papers on cardiac arrest resuscitation, including the use of mechanical CPR devices. As I stated during the hearing, my goal is to improve cardiac arrest survival in Kern County. However, above all, we must do no harm. Based upon the current published literature combined with our local experience, I have concluded that the auto pulse will not be returned to use in Kern County. We remain committed to continuing our efforts to improve our system of care and hope that we can agree to disagree and move forward and continue to collaborate to improve the care and survival of our patients.
So that concludes your comments, Dr. Lyon? Okay.
Yes, sir.
Thank you. As you guys will recollect, the paradigm under which we operate allows for an appeal to have been filed with MCAB. The MCAB board, our board, is the hearing board for that purpose. We make a recommendation to Dr. Lyon, but the conclusion at the end of that process is that Dr. Lyon's decision is the final decision. We do not compel him to make a decision one way or the other. It's his decision to make. So with that in mind, are there any members of the board who want to have a response before we receive and file Dr. Lyon's response to us? I just want to make sure that I don't want to go past this without giving somebody an opportunity. So does anybody on the board want to make a comment in response to Dr. Lyon's conclusion and report back to us? Okay, I'm not hearing anyone. So then thank you, Dr. Lyon, for responding to us. I appreciate your thanks to the board for trying to take this very seriously, and to Hall Ambulance for their commitment to our community. Those were good words, and I feel the same heartfelt gratitude to not only the board but the Hall and all the parties that were involved. So, Mr. Ferris, is it appropriate for us to have a motion to receive and file Dr. Lyon's report back to us about this unfinished business?
I believe we need to make sure and clear that through GK. I believe so, though.
Oh, GK, are you on the line?
I am, sir. Good afternoon. How are you? Yes, I believe that would be appropriate. I believe it also be appropriate, since the hearing was public and this meeting is public, to just see if there's any public comment on Dr. Lyon's statement, and then go to your receive and file.
Very good. I apologize for overlooking that. Are there any members of the public that would like to make comment about the report and conclusion we've heard back from Dr. Lyon? So I always ask twice. Is there anybody from the public that wants to make a comment in response to Dr. Lyon? Okay, I don't hear anybody, Mr. GK, Mr. Kalsa. So then is there a motion that we receive and file Dr. Lyon's report?
This is Earl Canson. So moved.
Thank you very much. Is there a second?
Leslie Wilmer, I'll second.
Thank you, Ms. Wilmer. Okay, could you take a roll call then to receive and file, Mr. Ferris?
Yes, sir. Chief Shoemaker.
Yes.
Bruce Peters.
Aye.
John Surface.
I think I'm supposed to abstain, right, GK?
You are a presenter and a principal in this matter, so we recuse you from any vote previously. I think it would be appropriate this time as well.
Okay.
Thanks for
Chris
thinking
Miller.
about that, John.
Yes.
Supervisor Maggard.
Yes.
And Dr. Kansen.
Yes.
And Leslie Welmer.
Yes.
The motion passes.
Okay, thank you. We've received and filed that report. Item number 10, new business. We have already dealt with all those on consent. Note that item E are the meeting dates for 2021. So make sure you guys, fold those into your calendar, however you go about doing that. Item number 11 is next, which is the manager's report. Mr. Ferris, could you give us your report, please?
Yes, sir. Thank you, Mr. Chairman. So since we met last, we have been attempting to engage our stakeholders again and holding regularly scheduled meetings that we hadn't held in quite some time due to COVID-19. We've held a system collaborative meeting, a quality improvement meeting, and actually 2 medical director forums for our field crews to meet and discuss with Dr. Lyon. So we're trying to get back on track with our regularly scheduled meetings. We did suffer a turnover. We had 1 employee that decided to leave, so we have a new employee, Eric Castro.
What is his role, Jeff?
He is, stand by 1 second, I'm sorry.
Bear with us, everyone. We're just getting a little technical glitch worked out here.
Hello, are you there?
Yeah, Jeff, we're here.
Somehow I got disconnected. I apologize for that.
You were going to tell us what Mr. Castro's role will be.
Yes, he is a coordinator, and he is taking over our certifications. So he's going to be in charge of certifications from here on out. And so he comes from us from Los Angeles. He actually began his career here in Kern County in EMS. He's been a paramedic for over 6 years. He left to go back to Southern California, where he was a firefighter in San Diego and San Bernardino counties. And he's decided to come back here and work with us where it all began. So I'd like to welcome him aboard.
Welcome, Mr. Castro.
Also, we have been continuing to staff our DOC, the Public Health DOC, since it opened in March. With us being at the table at the Department Operations Center, it opened a multifaceted approach with environmental health, public health, EMS, and public health nursing, so that we all have direct communications every morning to discuss the situation in our situations of developing in our county. We have continued to provide PPE and training, work to mitigate outbreaks, and work to help with emergent staffing needs as they've developed. We have filled dozens of requests for PPE as well as testing materials that we've received from the state, and track all incoming and outgoing materials. We have worked to develop policies that you all have approved. Several of these policies. AMA policy, we made some changes to assist our field crews. We worked with Hall Ambulance and the state of California to develop an alternative destination policy. Treat and refer policy, which allows the crews to treat and then not transport but refer patients to other medical professionals. Ambulance patient offload policy, and the inappropriate user policy. An update on that policy: we have served more than 20 individuals with cease and desist orders from inappropriately using the 911 system. One of those individuals has gone through the entire policy, and I'm currently writing the documents to serve him, which will inform him that he will no longer be transported unless the paramedic on scene deems it appropriate after doing a complete assessment. So he will be our first to complete that process. Additionally, we have requested waivers from the state of California that meant to assist the field crews. We have a static facility waiver, which allows EMTs and paramedics to work in static facilities, in emergency rooms, in SNFs and skilled nursing facilities. And we have been able to utilize that on numerous occasions since we received that waiver from the state. Specimen collection waiver allows EMTs and paramedics to collect the specimens using the testing materials. Pre-hospital vaccine waiver allows paramedics to administer vaccinations. They can do the flu vaccine, as well as once we get the COVID-19 vaccine, they can assist and participate in administering that vaccine as well. And then also certification waivers that have extended the length of licenses for paramedics and EMTs. We have also continued to monitor for hospital bed availability and ambulance call volumes just to make sure we have our finger on the pulse of what's happening in our county from day to day. And what we've seen is in the month of September and October, we've seen these numbers improve greatly, with available staffable beds increasing and the numbers of hospital COVID confirmed patients decreasing, and the similar numbers for ICU beds and ICU patients. And we've seen call volumes diminish over the past several months. They were at their peak in July during this last outbreak, and they have dropped, well, I'll say significantly in October, from the height of almost 11,000 calls in the month of July to under around 9,000 calls in the month of October. Now, with that said, we want to make sure that we don't relax at this point as we continue to monitor what's happening across the country and in other areas of the state. We are seeing spikes and increases in COVID-19. And so now is the time to maintain, stay strong, and make sure we get the message out there that we wear our masks and we do what's appropriate to try and diminish another outbreak or increase in COVID-19 cases. That ends my report, and I'm available for any comment.
Thank you, Mr. Ferris. I think it would be appropriate to give a little bit of context to our MCAB board about where we are with COVID, and I'll attempt to briefly do that. But if Mr. Constantine or Mr. Ferris want to supplement, or Dr. Lyon, of course, want to supplement this or correct anything I misstate, I'll try not to misstate anything, but feel free to jump in. But we've known from the outset that the disease will have an ebb and flow to it. It will get worse, and then it will get better. And we need to manage through the difficult times, the spikes, and then kind of reset when we're through those spikes. And we anticipated that there would be a number of them. It appears that a spike is coming as the cases are rising. However, we have carefully, and I realize I'm kind of saying some of what Jeff just said, but we have carefully tried to provide the capacity and the management of the resources so that we can, weather the storm, so to speak, when the spike hits us. And I'm confident that we can. I believe Mr. Ferris just implied that he is. I'd like to hear from Dr. Lyon and Matt Constantine that they are as well. But it appears that it may very well be that next week we find ourselves having to retreat back into the purple, more restrictive phase, as is much of California, as is much of the country, as is much of the world. This thing's gonna. We don't control that. It's just what happens. So I just want my colleagues on the board to hear that. I think we're in a good place, as good a place as we can be, to be in the midst of a pandemic we've never experienced before. It's a difficult spot. But would Dr. Lyon or Matt or Jeff like to say anything about that, or please correct me if I just misstated anything?
Supervisor Maggard, I agree with everything you said, this is a difficult time for everybody. It's scary for everybody, the uncertainty, the unknown, and we all want it to be over, especially going into the holidays. And I think it's really important for people to remember to not be complacent and not let your guard down, and continue to wear your mask or wash your hands and practice your physical distancing. Because right now, those are the tools we have to decrease the spread and the long-term effects and the deaths.
Yeah, and particularly, Dr. Lang, would you agree with this? Particularly if you have someone in your home who is vulnerable, either they have, diabetes or heart disease, or they're aged, or they're obese, or they are immunosuppressed, any of those comorbidities. If you have someone in your house like that, you are really playing with fire to have a bunch of people over to your house on Thanksgiving or Christmas. And if you are going to do anything like that, make sure that that loved one of yours is wearing a mask, and you're cleaning up and washing your hands, because if you have those comorbidities, you are at risk, right, Dr. Lyon?
I agree. If at all possible, try to do a virtual Thanksgiving or Christmas. If you must get together, everybody should wear masks, not just the person that's higher risk, because the mask that I'm wearing is protecting the other people as well, in case I am asymptomatic and have the virus. Additionally, being outside and, again, wearing your mask and maintaining your physical distance will help as well. But also, I think, trying to reach out and talk to people. People are having a tough time with this. Make a phone call to people you haven't seen or your family members. Try to FaceTime or use some other method to contact people, or talk to people with good physical distancing and wearing a mask. It may be hard, but for my family, we're not going to have an in-person Thanksgiving with all of our family together because of the risk that it puts. And everybody, when people get together, we're seeing that family gatherings, social gatherings are probably the biggest driver for the increased numbers. And so people tend to let their guards down when families around and they're together.
That's good advice, Dr. Lyon. Mr. Constantine, would you like to say anything?
Nope, I think Dr. Lyon summarized that very well.
Okay. Mr. Ferris, anything else on your part?
I don't think so, sir. I think it's been covered pretty well.
Okay. I think I said this at the last meeting, not the hearing meeting, but the one before that. We really owe a debt of gratitude to the hospital CAOs and their association. They came together with some members of a couple of members of the Board of Supervisors and with the health department, and really helped us work through some solutions to make sure we have adequate staffing so that we can staff the beds necessary, so that if the worst happens, we don't have people here that can't get into an ICU bed. And I just, the public will never know the depth and breadth of benefit there is to our community by that group working together so well. Bruce, could you make sure that the hospital CEOs know how heartfelt our gratitude is for them for helping work through that with us?
Yeah, absolutely. And that obviously goes both ways. I think the collaboration was exceptional, and it continues to this day. Got a phone call with Matt at 5, as a matter of fact.
Yes.
We're
When
staying.
5,
Yeah.
the whole
But
world
we
stands
appreciate
still.
all the support. Absolutely. Thank you.
Thank you very much, Bruce. Okay, so do any members of the public want to make comment about the manager's, Jeff Ferris's report to us? Do any members of the public on the call want to make a comment about Jeff's report? Okay, then it would be appropriate for somebody to please make a motion to receive and file Jeff's report.
This is Dr. Lyon, so moved.
Thank you. Is there a second?
Leslie Wilmer, I'll second.
Thank you, Leslie. Jeff, could you do a roll call?
Yes, sir. Dr. Lyon will be a yes, correct?
Correct.
Chief Shoemaker, Chief Shoemaker, I think you're muted, Chief.
Yes,
Thank you.
yes. Not bad.
Mr. Peters,
Aye.
John Surface,
Yes.
Chris Miller,
Yes.
Supervisor Maggard,
Yes.
Dr. Canson,
Yes.
and Leslie Wilmer.
Yes.
The motion passes.
Very good. Thank you, Mr. Ferris. The next item on our agenda, item number 12, miscellaneous documents for information. We have no miscellaneous documents today to present with this agenda, so we'll forego number 12. Item number 13 is an opportunity we give to each member of the board to make an announcement or any comments they have of their own initiative. So do any of my colleagues on the MCAB board wish to make a comment or any report to us now about any of your activities or observations? Just make sure nobody, as a part of the MCAB board, needs to make a report or make comment. Okay, very good. Item number 14 is announcements that we have coming up. So there are two of them. Our next regularly scheduled meeting is Thursday, February 11, 2021. The first time I've said 2021, I think, at 4 p.m. And we will see whether or not we have that meeting live or if we still do it via Teams, but it appears quite possible, in fact, maybe even likely that we'll still be in this format come February. So we don't know how long it will go out, but let's hope and pray that the vaccines are effective. And by the way, we didn't talk about that, but there's a great deal of, just so you guys, I think it's important for you guys to know about this, and Matt, feel free to jump in if I misstate anything here, but a great deal of preparation has gone into place at the national level, at the state level, at the local level, and even in the commercial places like in drugstores to accommodate the distribution of these vaccines. It requires a very, very deep, very cold environment to be stored. And for example, many preparations are going on to make sure that's there. So there's this unprecedented national effort to make sure we are ready to distribute that thing when they say that it's good to go. So we'll hear more about that in February, and hopefully by then some people are beginning to receive it. Matt, do you have anything you should add to that?
No, we're just anxious to hear about how this progresses, and this might change quite a bit of the dynamics. So we're obviously very involved. We're doing a lot of work to prepare. There'll be some announcements in the future, but it's moving along.
Yeah, let's hope and pray that it works, and soon. Okay, so our next meeting is Thursday, February 11th, 4 p.m. The deadline for submitting requests from the public for that meeting is Thursday, January 28th, 5 p.m. To get those to Mr. Ferris, our EMS program manager. So if anybody wants to do that, make sure you're aware of that. Are there any other matters before us that we need to deal with, Mr. Ferris?
No, sir.
And my colleagues, is there anything else you need to say or we need to deal with before we adjourn? I thank you all for your professionalism here. You know, this is, I used, when I first started doing this a long time ago and I was involved in UMCAB, I wondered, did anybody pay attention? Did it really make any difference? it makes a tremendous difference. And I'm grateful to all of you guys for you taking it so seriously. So thank you very much. With that, I would call for a motion for us to adjourn.
This is Chris Miller. I'll make a motion.
Thank you, Chris. Without objection, so ordered. We'll see you all again on February the 11th. Stay safe, everyone.
Thank you.
Thank you, everyone.
Thank you.
Thank you.